video on costochondritis, and I thought I'd do this video because I've had some people messaging about it, asking about what it is, and secondly, what they can do to help themselves, or if we can do anything to help you. So I thought I'd do this video, one, to explain a little bit more about what it is, secondly, give some advice on what it is you can do yourself, and thirdly, tell you what it is we can do to help you. So when it comes to costochondritis, basically what is it first of all? Well, it's basically a fancy name for chest pain. But chest pain which is linked right to the sternal border or the area of the insertional points of the breastbone. So you have the ribs that come round, that then turns into cartilage, and it's where the cartilage inserts into the breastbone here, which causes pain, discomfort and inflammation. So you can also have pain and inflammation come on through the ribs, the muscles that attach between the ribs. They call the internal and external intercostal muscles. They can come a bit strained and overworked, causing pain local to these areas round through here. And then also you have the pec muscles that come over this area here and insert into these borders, which can also come on to become strained and cause insertional point tenderness. Now, when it comes to costochondritis, it can come on for all sorts of different reasons. Generally, it tends to come on after having a cough or a cold or flu or pneumonia. So lots of prolonged coughing or lots of strain and stress through here can go on to cause pain. But also, if you've been exerting yourself quite a lot with any exercise or chest training or any sort of training you're doing, it can go on to cause an extra strain through here. So the type of pain you tend to get with costochondritis is a really sharp, localized pain, right localized to the sternal border here. And it's really, really sharp and it tends to come on whenever you're breathing in and out, especially if you take a deep breath in, or if you're moving from side to side or reaching your arms above your head, you'll feel a localized chest pain right through here. And this can tend to go on for quite a long time, quite a few weeks. And if you were to leave it and were to rest, it could go away after a few weeks or up to a month or so. But generally, if you keep exerting yourself, and especially if you've had prolonged coughing, then it can last for quite a long time. So things you can do to help yourself, well, one thing you can do is taking some painkillers or anti-inflammatories. I'm not personally a massive fan of taking anti-inflammatories, but if you were to go to a doctor, he would give you some, or you can take some ibuprofen just for the next few days or so, and that will help to release any tension you got through here. One thing I will go on to say as well, because if you have, before I go ahead, that if you do have this pain of costochondritis and you have lots of inflammation around the area, that can go on to cause what we call Tietze syndrome. And if you've got a redness and inflammation around through here, then you might want to go to a doctor to get some anti-inflammatories to help with that. But generally, if it's not so raised and really inflamed and really red, then you can just do some work for yourself at home. So you first of all using painkillers. Second thing you can do is use a hot or cold compress. Now generally I like to use cold, an ice pack. So if you've got any pain or inflammation, get a cold pack or an ice pack, put it over this area here and hold it for around about 20 minutes or so, and use that every hour or so, every few hours, to help reduce some pain down through there. Second thing, or third thing you can probably do yourself is doing some self-massage release work. Now, what you can do is if you go down your sternal border and you find there's hard points where the cartilage attaches to the bone, find the point which is really painful and apply a bit of pressure on that area. So if you're going to put on pressure on it, put pressure on it through here and then almost push it away slightly. So putting that pressure on there, if you get to about a scale of 0 to 10 scale, 0 no pain, 10 the most amount of pain, get to about a level 7. And you put pressure on there about level 7 and you hold it. And you keep holding it for around about 20-30 seconds up to a minute, or until the pain levels start to go down. When it starts to ease off slightly, you can then push a little bit further away and down, or you can go further down the sternum. And keep working around the area to do that self-massage. Now that's actually quite hard to do yourself if it's quite painful. So that's why people come and see us as practitioners to help with that. And generally, if people come and see us and they're getting pain through here, it can help relieve their pain off a lot quicker by working the whole areas than if they just leave it themselves. So the way we'd always work on it is if I have someone come to me, I'd always work on how to release the part of the spine here, get the extension back to open up the area. I'd work on releasing the ribs because the ribs wrap around the side through here. I would then go on to do some release work by adjusting the areas through here. I can also use my little activator gun and working around through here, and also work on the muscle release through here also. So there's all sorts of things we can do as practitioners to help release the pain and discomfort and help it go away. So generally, if you're finding this localized pain and you find it's not helping yourself by doing some work on it, come and see us or go and get some treatment somewhere, and that will help the pain levels go down. So I hope that gives you some advice and it helps you. If you have any further questions, just give me a message.